Welcome back. The Minister of Health, Hala Zayed, said that Egypt is currently witnessing the second wave of the coronavirus pandemic. Zayed added that there are currently 363 hospitals ready to receive patients and 200 extra ventilators available to face the increase in cases. The minister requested that citizens head to the nearest hospital in an event that they are infected and not specific hospitals in order not to cause overcrowdedness in these hospitals. Joining us over the phone is Dr. Mohammad Elshafei, a consultant and lecturer at the College of Medicine at Al-Azhar University. Good afternoon to you, sir.
Good afternoon. Good afternoon. How are you?
Yes. I'm good. Thank you so much. The PCR is considered one of the most important tests for diagnosing COVID. So what is the accuracy rate in the diagnosis and especially in following up on it?
First of all, I would like to greet you and our audience today and within health and safety. Back to your question, PCR is the most important test for diagnosing COVID-19. However, there are many considerations that must be taken into account during what? Diagnosis and also after recovery. First, the accuracy rate of this test doesn't exceed 60%. So if it's positive, it confirms the infection. But what if negative? It doesn't negate or exclude the infections. Second, after recovery. Next step, after recovery. What about the role of this PCR test after recovery? For many cases that have already recovered from the infection, the PCR remain positive.
Yes.
And accordingly, many patients were deprived from deciphering the isolation period and returning to their life and work. And this is the problem which exists now.
Yes.
Very important, and this is problem now. The condition for decoupling the isolation must be known and applied, regardless the results of PCR, to allow for the cured patients to return to their life and work. But what about this condition for decoupling the insulation? I will mention it in short, just for knowledge.
Yes.
For contact, only 14 days. Any patient to contact to a confirmed case, only 14 days. The confirmed cases, the minimum period of isolation is 10 days, provided that 3 days pass without symptoms. And the maximum of isolation, 20 days.
Yes.
Even if some symptoms remain. This is in short. So the decision for decoupling the isolation must depend on the PCR results. And this is very important that we must intend to activate this information in all public and private institutes.
Yes.
Because this represents an economic, social, and psychological burden for all.
Regarding the symptoms of COVID, what are the most important changes that have occurred in the recent period, and how would one deal with them?
So this question is a very important point, especially during that period, and this is very important going now.
Yes.
Now there is increase in the incidence of lung clots, and the most serious point is the occurrence of this clots without the classic respiratory symptoms like severe cough or dyspnea.
Yes.
Before, in the start of this disease, COVID-19, most cases coming for us without clots, little percent.
Yes.
Now, the reverse of the percent, most of the cases now coming with clots.
Yes.
And now we cannot see more cases with the classical infections of the COVID-19. Therefore, it is necessary to ensure the presence of lung clots for any patient with coronavirus infection by the following. I will summarize. Making CT chest on the first 5 days of the appearance of symptoms if there were respiratory symptoms.
Yes.
So any patient to confirm he is coronavirus, in the first 5 days, if he has respiratory symptoms, we must do CT of the chest. Or done after recovery. If one patient has no any respiratory symptoms and cure and finish the time and release from the isolation, so we must do also other CT after recovery. Last one, I advised all by follow up by doing CT scan to the chest for all those who recover every 3 months during the next year too, so that we are not to avoid to surprised by the occurrence of lung clots without us feeling it.
Okay.
Yeah,
unfortunately, sir, we're running out of time, so I'm sorry, I'm going to have to cut you off there. Dr. Mohammad Elshafei, a consultant and lecturer at the College of Medicine at Al-Azhar University, thank you so much for your insight on how to handle the new COVID.